Okay, we're going to go ahead and get started as people are starting to pour in here. I want to thank everybody for coming. Thank everybody responding to our outreach here for this particular webinar. And as always, I'm always excited to explain these types of things to as many people as possible, particularly our guys at Oklahoma Men's Clinic, and potentially even the women who love them. And we're going to talk about hormones, peptides, stem cells, and how that all can change your life, not only just for guys, but we're going to get into a few things here for women as it relates to how that can help men. So we'll go over 4 key sections: comprehensive hormone replacement therapy, sexual wellness and how we can enhance the penis, peptide therapy, that particular revolution, and stem cell therapy and pain management. So a little bit about me. Dr. John Robinson, I have been practicing since 2006, so it's just now been 19 years of doing this. I've been involved in the wellness industry since 1991. This has been a key part of my life for a lot of years, helping both men and women with all kinds of aspects of their health, taking healthy people and making them healthier. Advanced hormone replacement therapy and longevity medicine expert. I've written a couple of books. I lecture. I'm involved in all different types of wellness-based businesses. I love podcasting with my wife, Dr. Christina Romero Bosch. You can also follow us on Instagram at the Sex Docs, a little bit about us and our family, and me personally at Dr. Robinson, NMD. The first thing I want to get into is just really the power of hormone replacement therapy and what we specifically do at Oklahoma Men's Clinic and why it is so incredibly different from what I tend to see out there. Know that I practice also in Arizona. We have locations in California and in Florida, and of course, Oklahoma City and Tulsa. So what we do is comprehensive, and that's really what sets us apart. And then taking that comprehensive care and we're making it drive into actual real results, which doesn't always happen when you're working with this type of therapy and sort of the average approach. It isn't results driven, and it's definitely not get things figured out when it's comprehensive. So look, gentlemen, if you want to figure things out for yourself, you got to make sure you're figuring things out for women, at least having an understanding about what's going on with women. And so they'll have estrogen replacement or estrogen deficiency symptoms that have all kinds of things that are kind of similar to the things that we deal with when our testosterone goes down. Memory and focus issues. They have issues, south of the border with vaginal issues and all kinds of stuff. Certainly libido, which really isn't helping us if they have low libido. All kinds of mood disturbances. All these things make sense. They deal with osteoporosis, and so do we. And if women have testosterone deficiency, which they do, women need testosterone really for the same reasons we do. Guys, just we need more of it. So they're going to have libido issues. They're going to have muscle, a lack of muscle, inability to gain muscle and bone, and then all these other things related to immune and mood and many, many other things. So it's really important to make sure that women are getting corrected for your sake. So if you've got someone in your life, if your wife is still suffering with these things, make sure that the person that you go to knows how to treat women. Because if they don't, then they actually don't really optimally know how to treat men. And I think that's vice versa. So with these gynecologists that don't know how to do anything with guys, then they're not actually doing the best they possibly can. We have the ability and the skill to treat both men and women. So what's happening with guys? You know the story with testosterone. Motivation is probably one of the biggest things. I talk about that all the time. We need testosterone in order to drive mental and emotional motivation towards getting things done. Of course, fatigue, libido issues. Libido means the psychological desire and drive to want to have sex, but then also just functionality with the amount of ejaculate, power behind ejaculate, the actual erection itself. All these things are largely dictated by testosterone. So we want to make sure that we're figuring that out. We want to be able to optimize our ability to lose body fat and gain muscle. We want to get our moods handled. All of this optimizes us to be able to perform. So if we're going to move forward with testosterone replacement therapy or any type of hormonal issue, what are the treatments available for both men and women. And I like to really stress this particular slide. It's showing the different routes of how you can put hormone in the system. And one of the things is creams. And you can see down here at the bottom, it's showing just a graph of hormone levels on one axis here and days on the other. When you do creams, they're essentially just worthless. I've just seen this for 19 years. Same thing with oral forms. They never really get the levels up where they need to go and keep them there consistently. Patches can they're kind of rounded. You can see there in that yellow, it's kind of rounded for patches, but it's also not consistent. If we're dealing with hormone pellets or subcutaneous testosterone injections, we're going to keep the levels extremely consistent. It's just the pharmacodynamics of how that works. So those are the two things that we tend to focus on, pellets and sub-Q injections. So when it comes to the pellets, I've been doing pellets for 19 years. I always say there's not many people in the country that have been doing pellets longer than I've been doing pellets. My mentor, Dr. Gino Tutero, is the one who really put this all on the map. A lot of it started in California and ultimately really exploded in Arizona. And I was working with him early on in the beginning of that explosion. And I have treated thousands and thousands of men and women with hormone pellets. Generally speaking, in the hands of someone who knows what they're doing, it works. It's going to keep the levels consistent. These pellets are incredibly absorbable. The compliance is there. You set it and you forget it. That's a good part of it. It doesn't take very long to do the procedure. It can last up to 6 months. And this is for both men and women. Now, subcutaneous hormone injections, we usually think of testosterone injections or estrogen, testosterone, whatever for women. You think about it in this intramuscular injection, particularly for guys. And that is not always the best way to do it. It's an option. It's not a bad way to do it. But what we have found for a lot of guys, it can be painful to do those kind of injections. Intramuscular, it's a longer needle. If we're doing subcutaneous, it's a smaller needle, and we tend to do a twice weekly injection. So we take the normal amount that you would get in a week and we just split it in half and you just get it twice weekly. So that keeps the levels from going up too high or going down too low. So it's very, very consistent. And this is what we found over the years of doing this. Easier injection. So this comprehensive approach, this is really important. This is not just testosterone replacement therapy. TRT is dead. This idea of just simply saying TRT, this is old school and it's missing the entire comprehensive opportunity to be able to really help a patient. So you want to look at many different things, and that's what we do. Yes, testosterone, it's king. It really works, but it's not the only thing. There's another hormone called nandrolone. You look over here on the right-hand side of this slide. Nandrolone, this is a 19-nortestosterone. This helps with muscle. It helps with helping with arthritic pains. It's amazing. Estrogen and progesterone for women, making sure men's estrogen levels don't go too high. We're dealing with human growth hormone right here in the center. That's kind of the linchpin that holds it all together. Omnitrope, sermorelin, other peptides like CJC and ipamorelin. Metabolism and nutrition. We're going to definitely look at the thyroid if that's needed. NAD is probably one of the most profound nutritional injections you can do for energy and longevity, B vitamin injections. We're going to look at insulin and control. These GLP-1s like semaglutide, tirzepatide, even retatrutide, these are fantastic options. I've never seen anything work so good, and we've been prescribing them for over 5 years. We were early adopters of all this. We know exactly what we're doing when it comes to these things, and it's profound. Is it perfect? No, but you got to work with someone that knows what they're doing and how to really harness those medications. And then peptide therapy, same thing. This is, lately in the past year or two, peptide therapy has really exploded. And this is something that I've personally been prescribing for the past 10 years, early adopter of this, and it does many things, and we'll get into that in a little more detail later on. So again, comprehensive care, you can kind of see how we put this all together. You don't just want to do one thing. You want to have your foundation of testosterone. You want to make sure you're getting testicular support through gonadorelin or clomiphene, sometimes HCG, but clomiphene is what we tend to use. DHEA is another hormone we're looking at that has a lot to do with your libido, stress management and recovery. Nandrolone, I just mentioned that. NAD. And we're looking at human growth hormone enhancement, whether through actual human growth hormone like Omnitrope or these peptides like sermorelin. So you put these all together, now you have comprehensive hormone replacement therapy, not just simply testosterone by itself. So you decide to move forward. You're going to do hormone replacement therapy, comprehensive hormone replacement therapy. When are you going to feel better? You should be feeling better right away. And if you're not, then something's going on and we need to fix it. Okay, let's move into sexual wellness options. Now, gentlemen, there's a lot of options here for all of this. Again, we'll talk a little bit about women here. You might get a little bit of insight here on ladies a little bit. And again, I always encourage that. You can't figure out things for yourself if you don't know what's going on with your woman. So I think it is really important to understand we don't have to live with it. With this, there are always answers. Healing is always an option. So why do women have issues? And then there's many issues you can see here. First of all, 40 to 50% of women will experience some type of sexual dysfunction, female sexual dysfunction in their lives. And that can be about desire, meaning they're wanting to, arousal, being able to actually respond to the sexual response, achieving orgasm. And a lot of times women have some form of pain, and pain has a whole lot to do with why they don't have a desire or arousal or can't achieve orgasm. So a lot of times they want to, they just can't because they're in pain, and they can be incredibly debilitating, but there's answers for it. There could be medication issues. There certainly could be relationship issues. I think one of the biggest things is just communication and lack of intimacy. I've had the privilege and the honor of working with many couples that come in and talk with me about what's going on with their sexual lives. And we have that opportunity to really understand that a lot of times it is just that lack of communication. Psychological issues, of course, just depression and sexual esteem is huge for women. So we need to really make sure we're really building them up in order to get the best possible sexual response for them. And then, of course, just good old-fashioned hormonal changes. They need to get their levels checked just like you need to get your levels checked. So make sure they're doing that. Then we're looking into a deep dive into their menopause and other hormonal imbalances. Low thyroid often can have a whole lot to do with why they have sexual issues, is low thyroid. So what else we got? Now, reasons for erectile dysfunction. All right, gentlemen, what's going on there? Same thing. Look right in the center. Communication issues and lack of power. So for women, they have maybe a self-esteem issue. Men, we feel a lack of power in the relationship. And if we do, that can lead to ED issues. So making sure the power dynamic. I've talked to so many different psychologists and psychiatrists over the years. And that's really what it comes down to for a lot of guys. They feel a lack of power. And if they don't have that, then they can't really kind of correct the dynamic in that relationship, and it leads to ED. But sometimes that's not even at all what it is. It doesn't have to be relationship issues or even psychological issues. It's just flat out, you need to get your testosterone checked. You need DHEA handled. Sometimes guys come in and they're just overweight and they're making a lot of estrogen. That's shutting down their ability to have an erection. All kinds of medications cause problems with ED. The top two are definitely antidepressants, and probably the top one is blood pressure medications. I've just seen that for years. And so that leads me into the other thing. The medical conditions that guys tend to deal with mostly is cardiovascular. So the penis is the weather vane of what's going on with the cardiovascular system in the heart. So we've got to make sure we're addressing things on that level. And we do that really comprehensively when we approach things for you. We're looking at inflammation. We are looking at the endothelial dysfunction right here, that little word down there at the bottom of the slide, endothelial dysfunction. This has to do with the lining of your blood vessels, and those blood vessels that go straight into the penis. And we have ways of helping to correct that. So we look at it, of course, comprehensively without question. Sometimes guys have issues with how they're worried in general about their penis. So all of this relates, of course, to their overall sexual self-esteem, and their ability to maybe even perceive power within the power dynamic of the relationship. And so guys will sometimes actually have a dysmorphobia of having a small penis syndrome. And sometimes it actually is small. That's part of the problem. Sometimes it's just a perception. Sometimes it is what is ideal for their partner. And let's talk about what that means. So I absolutely love this slide and the research that was done on this. So usually guys love to look at this because guys, we like to measure things, and then we can kind of see what are people thinking about, what are women thinking about when it comes to what is preference for ideal penis size. So what you can see right here in this left-hand side and that sort of purplish pink there, that's ideal, you can see the range. And it's basically somewhere between 6 to 7 inches in length and some are around 5¼ to 5½ inches in girth. It's pretty straightforward. And then there's all these sort of ranges around all of that that can be quite broad. But average for a guy, it's around 5 inches, maybe not quite 5 in girth. So from that, what is average and maybe getting into an ideal really ultimately isn't that difficult to do with some of the options that we have. Now, I just want to come back to this study again. These women, what they did with these women, and why this was so accurate. What they usually would do with these kind of studies, they would tell the woman guess, or they would look at pictures and they would just kind of say, what do you think? And it was never really accurate enough. But what they did here, they actually used a 3D penis model, and they had a slew of them. And they would sit there and hold the model and be able to kind of feel it and get a decent idea. So this was really a super accurate study on what is ideal for women. So if we're going to help with sexual wellness, we're going to do it comprehensive fashion. We're always going to do it that way. Obviously, this starts with an in-depth doctor consult. We're going to look at hormone replacement therapy, and we're going to do that comprehensively. We're going to look at the ability to vasodilate. First of all, sildenafil, tadalafil, vardenafil, Levitra, Viagra, Cialis, these usual suspects. We have options for that and optimal options for that as well in terms of dosing and what we're doing with that. Nitric oxide, we measure your nitric oxide. Nitric oxide has to do with vasodilation, opening up blood vessels. And if that's not working well, then we need to correct it. And there's nutritional and medical ways to be able to correct that. But you got to measure it, and we do that for you. There's Trimix. Gentlemen, if you are suffering in any way or any in-depth way, let's say, with erectile dysfunction, and you've tried everything, but you've not tried Trimix, these very, very strategically placed injections into the penis, it is life-altering. It is amazing how it works. I can't begin to stress it enough that if you're having those issues and you don't think that you can actually get a solution, we've had men who haven't had erections in decades walk out of our office with an erection. So please keep that in mind. Sometimes we have to focus on arousal. We've got different peptides for that, bremelanotide, or what's known as PT141. We use oxytocin, another arousal type of hormone that works for both men and women. And we definitely treat premature ejaculation. I had a patient just this morning that I treated for premature ejaculation. And one of the key things that we'll use many things, but one of the key treatments is something called duloxetine. This is a short-acting psychiatric medication, an SSRI, but it's short-acting and you can use it just for that. And it works really good. Aesthetic enhancement, we're going to talk about elongate. We're going to talk about fallofill. Sometimes we need to actually just treat the tissue for erectile dysfunction. That's this area on the right-hand side of the slide, functional tissue regeneration using acoustic wave, the P-shot for guys, stem cell therapy, exosomes. We look at it comprehensively. We don't just have one thing. If there's other players out there and they're only doing one or two things and they don't have the ability to come at many different angles, they're not treating it comprehensively and they don't know what they're doing. So again, we're pasting everything together. It's just another visual, this idea of the comprehensive approach. From mild, moderate, all the way to severe erectile dysfunction, we've got these answers that provide results that you're looking for, that you want, need, and deserve. This slide here on elongate, let's talk a little bit about elongate. Elongate is a procedure that we've kind of started to work with here over these many years in actually increasing both length and girth. The classic P-shot for men, which is using platelet-rich plasma, we draw it from your blood, we spin it down in a special way, and we strategically inject that into a very, very numbed penis. And this helps with laying down new nerve growth and new blood vessel growth. And that classic P-shot itself can give you a little bit of length and girth. It certainly can help with erectile dysfunction. But what we're doing is we're actually doing, you can see on the lower left-hand side of the slide, we're giving you 6 P-shots once a month for 6 months. We're giving you nitric oxide supplementation for that. There's a vacuum pump that goes along, and then another device called a penile extender by Restore X. You can even look that up, and that works too. When you put all that together, you can get really good results here. So this is just a quick example. It's kind of hard to see it here, but essentially this particular patient of ours 58-year-old male, definitely got just a little bit over an inch in length and definitely over an inch in girth over about 6 months. And these are not uncommon results if the guy kind of plays ball and does this over 6 months. So you can actually get permanent, natural results for length and girth. If you are looking for girth, no matter what, if you're wanting to know that you can walk out of the office essentially with an increase in girth considerably, there's something called Fallofill. And we are Fallofill certified providers. There are not many that are certified to do that. And we are exclusively the only ones in the state of Oklahoma that does Fallofill. This is a very specific procedure. It was developed in Dallas and is now a national procedure with a national group of physicians that are using this. This is using hyaluronic acid. It's a typical filler that they use in the face, but you can actually strategically place this into the penis and you get instant results. I encourage you to check out the website for Fallofill and you can see the results for yourself. It is dramatic. So if guys are looking for that girth right away to be able to help with their particular sexual wellness, Fallofill is a fantastic answer. So premature ejaculation, yes, a lot of guys deal with this. If anyone is out there dealing with that, listening to what I'm saying right now, you are not alone. 9 out of 10 guys ejaculate within 1 minute. Now, what's interesting about the diagnosis, I would say, of premature ejaculation, it is usually within 1 minute and it bothers the guy. So it actually has to bother the guy. So they won't actually diagnose it, interestingly, unless it's actually a problem. Now, for most guys, I would say it probably is. For most women, I'm definitely going to tell you it usually is going to be a problem. But sometimes guys don't even realize that. Or maybe their partner, their wife isn't really telling them that it is. But very often it is. So it's something you might want to really strongly consider getting fixed. And we have ways to deal with that. Even that trimix that I had mentioned, the trimix that really helps with erections, we can give very, very low doses of that to keep a man erect after he has ejaculated so he can continue to have intercourse and sometimes have multiple orgasms and still maintain the erection. So that usually can be a really fantastic solution. Then you kind of get the bonus. So again, testosterone, I'm kind of explain that a little bit. Testosterone, sometimes that alone is enough to help with it, but usually it isn't. Duloxetine, I had mentioned that particular medication, a short half-life, fast-acting SSRI, giving sometimes just Cialis, Viagra, Levitra in a fast-acting lozenge is what we usually use. Just even a little bit of that is enough to take the edge off to help a guy to continue to maintain after he's ejaculated. And again, that low-dose trimix that I had mentioned. All right, let's talk about peptides. Look, peptides, this is really, it's exciting stuff. If you're not aware, I'm here to tell you that this is where it is going. We are moving in this direction. It's going to happen. It's already happening. But I mean, you're going to see it even more. You're probably going to see it even more in conventional medicine. You know, the type of medicine we do, we are outside of the box type of medicine. Your regular doctor is not going to do what it is that we do over at Oklahoma Men's Clinic. We're, again, out of the box. But you're going to see more and more of that conventionally. And it's coming. But we're already dealing with it. So people say that peptides, what is this? And I just got a few slides really on this because I just really wanted to focus on what the difference is. I mean, what's really going on with these peptides? It's kind of a loose term. People are saying it. Doctors often don't know what the hell it even means, let alone a patient coming in and having an idea. So I created this slide to kind of show you a difference between peptides, hormones and what they're doing and their action, and then regular drugs. So the mechanism of action right here at the top, peptides are actually stimulating a natural production of other hormones, of other actions inside cells. So there's really a synergy that goes on with all of that. And it's stimulating the outside of the cell membrane, where hormones are enhancing body functions. Testosterone's coming in and really changing things in a very specific way. And the body's recognizing that. They go, okay, testosterone, I understand what that is, and I will listen to this message, and I will create an enhanced body function then. Drugs are coming in, and they're just forcing things. And it's dominating the systems on what's going on. What about the size? Peptides, they're really small. These are peptides literally can be only like 2 or 3 amino acids long. They can be very, very small. Hormones, they tend to be much bigger. They're usually cholesterol based. They can be much bigger, but even then they can be small. And then drugs, of course, their chemical constituents are usually very, very large. Again, for peptides, they're affecting cell membranes. Hormones are kind of getting inside the cell deeper. It's affecting DNA. So it's moderately specific. And then drugs, again, harsh. It's, as I'm saying here, the clinical effects are kind of like a bull in a china shop. That's what's going on with drugs. For peptides, it's a quick onset. For hormones, it's a little bit longer. That's why we say when you start testosterone, you give it a month. It's not necessary. I mean, guys will feel pretty good right away sometimes, but you really want to give it some time because it takes a while. You're literally changing the DNA. But when it comes to peptides, you're getting this quick clinical effect, and people notice things even more rapidly. So the side effects for peptides, this is what's also amazing. I always say that the peptides are clinically forgiving. The side effect profile for most of these peptides that we use, it's virtually zero. Hormones, they are moderate in their side effects, but if you know what you're doing, then usually it isn't a problem. And then again, drugs, these, as we all know, they just come wrought with all kinds of side effects. So peptides, even hormones, it's been there for years. Peptides is kind of moving in this direction to where it's going to be even better and even more options. So there are so many different peptides, and I didn't want to get into all of them because there's probably over 7,000 different peptides that are out there in the midst of being studied. We probably deal with about 30 different types of peptides, with maybe half of a dozen being the key ones that we tend to use. But there's many. But what I've done here is to just kind of shown you the categories of what it's helping with. So in the upper left-hand corner, yes, it's helping with erectile dysfunction and sexual wellness. There's many options for that. It's definitely helping with growth hormone stimulation. We can give you peptides to help your pituitary produce more growth hormone. It's a far more natural way to go. Weight loss, this is the tirzepatide and the semaglutide and these types of things that we've all heard about. And these are forms of peptides that, again, work amazingly well. The right-hand side here on the top, post-exercise recovery, tissue repair and regeneration, and even hair growth. All these things are amazing what they can do. We have peptides that are literally like, we call it the Wolverine. I mean, it is literally regenerating tissue in a profound way. The lower left-hand corner here, mitochondrial energy types of peptides. So there's peptides specifically for your energy. A slew for your brain, and definitely just general things for longevity. We have peptides that are a little bit more about these various systems in the body for your heart, many, many peptides for your immune system, and even gastrointestinal, IBS, and these types of things. So we can affect many different parts of the body with a multitude of peptides that, again, are extremely clinically forgiving and effective. So why are we different when we're working with peptides? Again, about everything that I've been saying here, we have a comprehensive approach. If they don't have a comprehensive approach in sexual wellness, if they don't have a comprehensive approach in working with women for the sake of our guys, if they're not doing things comprehensively with hormone replacement therapy, then they don't know what the hell they're doing. It's just, this is the way it is. There's so much monkey business out there right now. And I've been at this for so many years that, you know, I was one of very few. And now there's many, and I think it's a good thing in the sense that it's brought more of an awareness to these types of therapies, peptides included, but it's also created a lot of really bad players out there. So the other thing is to this pharmacy grade, there's these research types of garbage out there, meaning they're called research quality peptides, and they're found online. You do not know what you're getting. You're literally putting your own health in your own hands, and I would really discourage that. So again, you want to look for comprehensive. You want to look for people that know what they're doing. Let's talk about regenerative medicine. This is another thing that we're doing at Oklahoma Men's Clinic. You know, living with pain can be a really big issue for people, and stem cell therapy can be an option. Regenerative medicine, which is this other very cutting edge way that medicine is moving, can be a massive help and change for people. So let's get into that a little bit. This is a quick disclaimer. We're talking about stem cells, exosomes. These are not FDA approved. They're structural tissue products. There's no guarantee, of course, of healing. I'm not making any major claims here with this. This is not medical advice, of course, but there are definitely some things that we can learn about today about stem cell therapy and how, if you see a physician at one of our locations, either in Tulsa or Oklahoma City, that you could potentially get some help. Pain has a huge cost. Anybody that is listening to me right now that's been in pain, you know what it is. And you can't be the best possible protector and provider as a man if you're in the midst of pain. And I always say life's like an airplane here. You've got to put your own oxygen mask on first. That's why they say that. You got to make sure you're taking care of you before you can turn around and take care of your loved ones in your life. And pain winds up really derailing a lot of that. But if we're going to work with stem cell therapy, and that's what I'm talking about here, stem cells, structural tissue products, that's what we're using. These are very, very specific types of products. They're homologous. That's a fancy word for saying it's the same type of tissue. And they contain all kinds of growth factors and structural proteins that are very, very similar to what would be in your shoulder joint or your elbow joint or your knee joint. And along with those growth factors and those structural proteins, inevitably we work with stem cells as well. These stem cells come from umbilical cord blood. They're known as mesenchymal stem cells, MSCs. There's also exosomes. These are little message packets as well that are part of the whole stem cell process. And then also something else that we offer that's part of this whole game is just platelet-rich plasma. And again, we're getting that directly from your own blood. And we're already doing that with things like the P shot. But we can take that same product that's been injected into joints for 30, 35 years now, and from an orthopedic standpoint, we can inject that into a knee, into a shoulder, and that alone can be very, very helpful. Sometimes that's good. That's like a nice starting point. Sometimes we move more into more advanced stem cells, depending on the severity of what's going on with a patient. And so, again, where are we getting these from? They're all American Association of Tissue Banks certified. It's the highest quality of what we're looking for. They're going to be third-party tested for sterility and all kinds of, they're screened for every disease known to man. And, we're making sure that we're getting the best possible quality for you. So let's talk about stem cells. Again, fancy word, mesenchymal stem cells. These are immune privileged, so your body won't reject them. They're antibacterial. They're very, very this immune privileged, immune stimulating types of cells. They also bind to your pain receptor sites. That's another reason why stem cells just help. They break down scar tissue, and they're extremely regenerative. That's one of the biggest things. They're regenerative. They literally will hone in. A stem cell goes through your body and seeks out where there's damage, where there's need for repair. It actually knows what it's doing on its own. So I always say that the stem cell is like the architect. It is the builder of what's going on when it's trying to repair. Now, PRP, another thing called PRF, it's essentially the same thing, platelet-rich plasma or platelet-rich fibrin. Again, we're drawing your blood, we're spinning it down in a very, very special way, and we're extracting out the growth factors and injecting that strategically in the body. Again, that could be like our classic P shot for the penis, and what we're talking about right now is how it can help with joint stability and regeneration. So it's powerfully anti-inflammatory. That has a whole lot to do with why we have pain. If we can pull down inflammation, we help with pain, but we're doing it in a natural way. Obviously, people can get cortisone shots. That helps with inflammation, but it's at a cost. It has long-term negative effects with cortisone shots. We do not have that problem with PRP. It is natural. Helping with modulating your immune system. It's promoting that tissue repair. And so platelet-rich plasma winds up being more like this foundational type of thing. We have the architect kind of building things with the stem cells, but a foundation of these scaffolding proteins really can come from just good old-fashioned PRP. So what are we treating? We're definitely helping with joint pain and regeneration, but things like arthritis, neuropathy, ligament and tendon issues, even meniscus tears can be helped. So even when they are telling you that absolutely you must have surgery, it doesn't mean absolutely you need surgery. Sometimes it does. We make that assessment. Sometimes, look, it's just surgery. But many, many times when they're telling you that it has to be surgery, it doesn't necessarily have to be, or it doesn't have to be surgery at the time frame in which they're saying. So sometimes we'll get guys and women who will do this therapy and they were thinking they had to do the surgery in the next 3 to 6 months, and they wind up getting years before they actually have to do it. And of course, erectile dysfunction, female sexual dysfunction, that's what I was explaining before. So when it comes to pain, a lot of patients will come in, they're right around 7, 8 or so out of 10 or higher. And then we get that down to about a 3 or 4 in most patients in about a handful of months. And even in a short period of time, it really will improve. But usually it's that sort of 90-day thing for most patients when they start to get most of the benefit from these types of stem cell and PRP therapies. Of course, as I've been saying, if there's one word you take away from what it is that we do, it's comprehensive. It's comprehensive with everything: the sexual wellness, hormone replacement therapy, peptide therapy, and now our comprehensive approach to regenerative medicine is going to include all of these various options. You can see the PRP, the PRF, stem cell, something called Wharton's jelly, exosomes. All of these structural proteins and structural tissue products can help depending on the patient's needs. We're going to look at it comprehensively. We're going to make sure your hormones are balanced. If somebody walks in and says, I have pain in my knee, and he's had issues for years, and he's not on any kind of HRT, he's missing the boat. Because a lot of times that becomes very anti-inflammatory, it becomes very regenerative. They can gain muscle that helps stability with a joint. I mean, there's so many reasons. And then, of course, peptide therapy. There are really, really some very, very amazing things. BPC 157, you can see here, that's one of the very well-known peptides that are out there. Been prescribing this for years. You can actually take that peptide and inject it strategically. You can inject it yourself strategically into an area of concern. So I've been doing it right now. I've got like a medial epicondyle issue from lifting weights. And I've been right now injecting it only for about the past week, and I'm already feeling better. And we usually have a course of about 7 weeks on that one. So that alone can be very, very helpful, but we usually incorporate that in with the whole approach. Just depends on the patient and their needs. And acoustic wave therapy. So if you're getting any of our stem cell therapy comprehensive sort of packages, it's going to include acoustic wave, and that too can help. So when you put that all together, the patient's going to get the best possible care and results. So just specifically, I'm talking about pricing here only as it relates to the regenerative medicine here. So if our pricing for just PRP or PRF into an area, $695. When it comes to the stem cells, and that's going to range between $2,500 up to about $9,000, $10,000, depending on what it is that you're needing to have done, how much of the product is needed for your particular situation. But I'd say average on stem cell is right around $3,000 to $5,000. The 10 is not very often, but sometimes it's there. And then, of course, coming in, like I really want to encourage you, if you've got issues, check it out. Come in and get a consultation and exam by one of our doctors. It's complimentary. So come in and check it out. Have a detailed history taken. Talk to the doctor. They often will do certain orthopedic exams, certain things, and see what's going on. They can look at your imaging studies if you happen to have them, and really get a great plan for you going on. So what is I'm offering today, the company's offering, if you decide to do a stem cell package, we're doing $500 off any of those types of stem cell packages, and $100 off the PRP, the PRF as well. So this is if you're going to book in the next week. We have these options available for you. Please know we do have financing for everything that we've talked about today at Oklahoma Men's Clinic. We have financing available, whether that's for sexual wellness, comprehensive hormone replacement therapy, any of our peptides, and of course, the regenerative medicine and stem cell therapy we're talking about now, we have financing available. So I think, yeah, that's it. Some questions here. Just want to encourage everyone and let you know that, Tulsa, our Tulsa location is doing fantastic. We do have a great doctor there, Dr. Nia, who has actually been with us for many years and has come back on board, doing a great job with us, of course. And things are going great there. So encourage everyone there to know that things are fantastic. Someone's also asked here, what's the difference between Clomid and gonadorelin? So Clomid or clomiphene is an oral medication that winds up telling your testicles to make testosterone and sperm. So we use these to make sure testicular function is always optimized while you're on testosterone therapy and other hormones, particularly testosterone. So I would say keep the boys happy. Testosterone will shut down the testicles just a little bit, but if you add in Clomid, it will help with that. Gonadorelin is another tool. This is a peptide that's also very similar. It's sending a signal actually through the brain down to the testicles, where Clomid is working more directly at the testicular level and telling the testicles to make testosterone and sperm. Gonadorelin is sending a signal down through a part of your brain down to the testicles to tell the testicles to make testosterone and sperm. So that's kind of the difference. We've used both. I really think in the end, Clomid is likely a little bit better. If I had to give a nod to one or the other, I'm going to give it to Clomid. And this is just after years and years of using both. I think gonadorelin is good. If I had to give that slight edge, I'd give the edge to Clomid. So I really want to thank everybody who came. We really had a good response with this webinar this time around. I have recorded this webinar. So know that we're going to put this recording out there. And I'm saying this now. Anyone who's going to listen to the recording, you're welcome to come in. We welcome you in. These particular specials that I have here are offers only for people who have attended the webinar, including all the people that are on here now, have an opportunity to take advantage of this. But we're going to have another webinar next month. I'll do the same thing. If people want to take advantage, particularly of these stem cell offers, 4 weeks goes by pretty quickly. You could even get your ID. You'd be able to come in and get your exam, and you wouldn't be able to get the offers until we roll around to the following month. Because I just want to make sure I'm being really fair to the people who really do show up to these webinars, because many people do. And so I want to be fair to them. But know that I'm going to do these webinars every month for all our guys and women in Oklahoma Men's Clinic. So I want to thank everybody. Know that I am always available. Again, I'm the founder. I'm not always there, but I'm always there in spirit, and I'm constantly doing my best to help things at both locations. So if you want to reach out to me personally, I'm always available. My personal cell phone, we give that out, whoever wants to talk to me. So thank you again, and I'll look forward to seeing all of you, and they'll all be waiting for you, and people will be reaching out. Thanks again.